talk about E. coli. Is this dangerous? Is this something that we need to do something about? How do we treat it? So again, CDC is investigating a multi-state outbreak of E. coli, especially 0157 strain. 29 cases reported thus far, 15 in Michigan and 14 in Ohio. Hi everyone, Dr. Partha Nandi, talking about an important topic here, E. coli outbreak, and what you need to know about it. I'm a gastroenterologist, and I've treated many people who've had E. coli infections, and right now it seems like there's an outbreak, especially here in Michigan and in Ohio. So we've had 29 cases of E. coli thus far, right? 29 cases and 15 in Michigan, 14 in Ohio. For those who are just joining us, talking about an E. coli outbreak and what we need to know, what you need to know, because lots of people have ideas about E. coli, but most folks don't have a good understanding of it. So I'd like to talk about E. coli. Is this dangerous? Is this something that we need to do something about? How do we treat it? So again, CDC is investigating a multi-state outbreak of E. coli, especially 0157 strain. 29 cases reported thus far, 15 in Michigan and 14 in Ohio. Again, what is E. coli, right? E. coli is short for Escherichia coli, bacteria that can be found in a lot of our environment, right? Food, the intestines of people and animals. Most E. coli, remember this, most E. coli are harmless, right? But some can make something called the Shiga toxin. So toxin, not something that's good, right? So it can actually cause severe problems, severe stomach cramps, vomiting, fever, bloody diarrhea. I've had some patients this week that have come in with that. So again, when they cause the toxin, it produces the toxin, can cause severe stomach cramping, vomiting, fever, bloody diarrhea. Most common toxin-producing E. coli is called 0157. So you may have heard about this. And it's the main bacteria behind the national outbreak, right? So health officials say lab results have really linked few of the cases to each other, but we don't know yet if it's a particular type of food or what exactly is going on. So how do you get infected, right? One of the questions that many of my patients like, how did I get this, right? So a person gets infected through eating, consumption of food or drinks that have been contaminated with human or animal feces. So that's important to know. So when you have food or drinks that have been contaminated with either human or animal feces, that's when you can get this. Now for treatment, no specific treatment for these types of infections, and diarrhea. Remember, if you have severe diarrhea, have to keep hydration. So don't get dehydrated. Important to drink plenty of water. If you have Gatorade, juice, you have to stay hydrated. Some infections are mild, right? Others may not be. Most people, they get better within 1 week. Unfortunately, about 5 to 10%. 5 to 10% of people get this potentially life-threatening complication, and it's called hemolytic uremic syndrome, HUS. And symptoms, you'll have decreased frequency of urination, really tired, color loss in your cheeks and inside the lower eyelid. So hemolytic uremic syndrome can be very dangerous. I've seen that in my life, and it can be life-threatening. So how do you not get this, right? How do you prevent this E. coli infection? So remember, wash your hands. Very, very important. Wash your hands before handling any food and after using the bathroom, changing diapers, or after contact with animals. Cook meats very thoroughly. This will help destroy the bacteria. And also wash fruits and vegetables with running water before eating them. Don't just pop them, take them to the grocery store and put in your mouth, because it's important to be able to run those through wash those through running water. And keep produce away from raw meat, because you don't want them to mix. Don't let raw meat, don't let eggs or cooked meat sit at room temperature for any period of time, especially at more than 2 hours. Best to put them in the fridge or freezer. If you're eating in a restaurant, so important, and the food is not cooked, please send it back. Some people feel bad. Don't, because it's not worth your health. You wouldn't believe how many of my patients come and say, well, I ate at this place and I didn't think it was quite right, but I ate it anyway, and then I got sick. It can be serious. People get hospitalized from this. Remember, burgers and ground beef should not typically be pink in the middle. That's what I tell my kids. Burgers and ground beef should not be pink in the middle, especially in the middle of an outbreak like this, right? So you want to make sure that the food is well cooked. If it's not, don't be shy, send it back. And then if you're experiencing symptoms, we talked about that, right? If you're getting symptoms, then make sure that you see your doctor, right? And so remember, if you have diarrhea, if you have abdominal cramping, if you have fevers, remember to let your doctors know that, hey, here's what's going on. So stomach cramps, vomiting, fever, diarrhea can be bloody as well. So if you have those, talk to your doctor right away. If you have any questions, obviously, we will keep this live on. You can ask anytime. And hello to Faye Rogers. Faye, thank you for your kind comments. And then Tina says, does a Hep A shot help not getting it? No, not related. Hep A shot is not related to this, right? Because I think the reason why you may be asking that is because hepatitis A can cause some GI side effects, but it's totally different. This is a bacterial infection. Remember, hepatitis A is a viral infection, so very important. Again, just for those of you joining us, multi-state outbreak of E. coli 0157. That's a toxin-producing variant of E. coli. So we'll keep you up to date as more of these cases, if they do come. And it's important to know. Take it seriously. If you have anybody with diarrhea, vomiting, fevers, especially bloody diarrhea, let your doctor know right away. All right, thanks for watching and thanks for listening. Appreciate it. Enjoy the rest of your day. Make healthy living a part of every day. Hi, everyone. I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.